Most approaches to therapy, to self-help, to personal development, begin with a version of the same question. What do you want? What are your goals? What would make you happy? What do you need that you are not getting? The frame is consistent. The person is at the center, and life is a resource to be drawn upon in the service of the person's desires. Viktor Frankl thought this framing was not merely incomplete. He thought it was one of the primary sources of the emptiness that brought people to his office in the first place. The question Frankl asked instead was this: what does life want from you? The grammatical reversal is small. The philosophical shift is enormous. It moves the person from subject to respondent, from the one who demands to the one who is demanded of. And in making that move, it opens up a dimension of meaning that the self-focused question systematically closes off. Frankl developed this reorientation with great clinical precision. He observed that patients who came to him suffering from existential despair, the feeling that life had no meaning, that nothing was worth doing, that existence was fundamentally pointless, were almost universally caught in the self-focused frame. They were waiting for life to offer them something sufficiently compelling to justify their engagement with it. They were, in his metaphor, like students waiting for the teacher to give them an exam they felt like taking. And the longer they waited, the emptier the classroom felt. His response was to change the metaphor entirely. Life is not an exam you take when you feel ready. Life is an examiner, and it is already asking you questions. Right now, in your specific circumstances, with your specific history, at this specific moment in time, life is presenting you with demands that only you, in your unique position, can answer. The question is not whether you feel like answering. The question is whether you are willing to recognize that the exam is already underway. He illustrated this with a concrete clinical technique. When a patient told him they had nothing to live for, he did not argue with them or try to convince them that they did. Instead, he asked a series of specific questions. Is there anyone who depends on you? A child, a parent, a friend who needs your presence? Is there something you know that you have not yet passed on? An experience, a skill, a hard-won understanding that someone could use? Is there something in the world that would be slightly worse if you had never existed? A relationship, a project, a garden, a community? The patient's first response was usually denial. But the questions had a way of finding their target, because they were aimed not at abstract meaning but at the specific, concrete, already existing demands that the person's life was making on them. One of the most moving cases Frankl described in this context involved an elderly man who was suicidal following the death of his wife, with whom he had shared decades of life. The man had given up entirely. There was nothing left, no one left, no point. Frankl did not try to tell him his grief was misplaced or that he should focus on the future. Instead, he asked, "What would have happened if you had died first?" The man immediately saw it. She would have had to bear this grief. His survival, his endurance of this pain, was the price of her being spared it. In a moment, the question transformed the meaning of his suffering. He was not suffering because life had become meaningless. He was suffering in the service of a love that had been, and remained, the most real thing in his experience. The shift from what do I want to what does life want from me is not merely a therapeutic trick. It reflects a fundamental philosophical claim that Frankl believed was empirically supported by everything he had observed in the camps and in his clinical practice, that human beings are not primarily consumers of experience but respondents to meaning. The deepest well-being available to us is not found by pursuing what we desire but by discovering what we are genuinely needed for. What in the world would be missing without our specific presence? In an age saturated with advice about self-care, self-actualization, and the pursuit of personal happiness, this message cuts against the current. It asks not for more attention to oneself but for less, or rather, for attention redirected from the self to the genuine demands that one's particular life is making. It asks the hard question, not what do I want from my life, but what is my life asking of me? The answer to that question, wherever it leads, is the beginning of the only kind of meaning Frankl believed could genuinely sustain a human being. The question Frankl asked, what does life want from you, is not a formula that can be applied mechanically. It requires the person to actually look at their specific life, with its specific history, its specific relationships, its specific position in the world, and listen for what is actually being asked of them. This is uncomfortable work, because the answer is never abstract and never convenient. It always points somewhere specific, towards some person or task or commitment that is genuinely present and genuinely demanding. But it is also the only kind of work that leads to the kind of answer that genuinely satisfies, the answer that when found does not generate more questions about whether it is the right answer, but simply becomes the direction in which the whole of life begins to move. Subscribe to The Psychology of Viktor Frankl to explore more of his timeless ideas.